Superficial fungal skin infections are fungal infections that affect the outer layers of the skin, the nails, and the hair. And when florid, it may be associated with immunosuppression, such as in diabetes and retroviral infection, and also even in corticosteroid abuse. So the main causes are dermatophytes like tinea, that is mycosporium, epidemophytin, and trichophytin. Also yeasts like candida and malassezia. So the symptoms are itchy, scaly ring shaped rash on the skin. Also, scaly, bald patches of the scalp, distorted, discolored finger or toenails, itchy and sore skin folds, and also scaly patches of skin with altered pigmentation. So the main signs that are usually elicited are around scaly patches with thickened edges and clear center on the skin, scaly bald patches of the scalp, distorted discolored nails, altered pigmentation of skin, as a hypopigmented or brownish appearance, and also pustular rash in the flexures. So the main investigations are skin scrapings for microscopy and culture, as mycology, also nail or hair clippings for microscopy and culture, FBS and HIV status, and if infection is florid or oral candidase is present. The main treatment objectives are to eradicate infection, also to prevent transmission, and to identify and treat any predisposing conditions. Non-pharmacological treatment, good personal hygiene, use of loose clothing, open footwear. Of pharmacological treatment in dermatophyte infection of scalp like tinea, capitis, or capitis. You first line treatment, you give griseofulvin oral. So griseofulvin oral in adults, you give 500 milligrams daily, double in severe infection for 4 weeks. And in children, 1 month to 12 years, we give 10 milligrams per kilogram with a maximum of 500 milligrams once daily in two divided doses for 4 weeks. And 12 to 18 years, give 500 milligrams once daily, or in two divided doses, and maybe doubled in severe infections for 4 weeks. And second line treatment, you give terbinafine oral. So for terbinafine oral in adults, it's not recommended, but it's in children over 1 year, you give 250 milligrams once daily for 4 weeks. As with a body weight more than 40 kilograms, but 20 to 40 kilograms, you give 125 milligrams once daily for 4 weeks. And 10 to 20 kilograms, you give 62.5 milligrams once daily for 4 weeks. Dermatophyte infection of body like tinea corporis, or perineum like tinea cruris, and also hands like tinea menum, and feet like tinea pedis. So tinea pedis, you give first line treatment, benzoic acid compound ointment, normally Whitfield's ointment. It's topical. In adults and children, you apply twice daily to patches up to 1 or 2 weeks after the last visible rash has cleared. Or you can give clotrimazole 1% topical. In adults and children, you apply twice daily to patches up to 1 or 2 weeks after last visible rash has cleared. Or you can give miconazole 2% topical. In adults and children, you apply twice daily to patches up to 1 or 2 weeks after last visible rash has cleared. Or you can give cyclopirox olamine 1% topical. In adults and children, you apply twice daily to patches up to 1 or 2 weeks after last visible rash has cleared. A second line treatment, you give griseofulvin oral in adults 500 milligrams daily, double in severe infection for 4 weeks, and in children 12 to 18 weeks, give 500 milligrams once daily, or in two divided doses, may double in severe infections for 4 weeks, 1 month to 12 years. Give 10 milligrams per kilogram with a maximum of 500 milligrams once daily, or in two divided doses for 4 weeks. Or you can give itraconazole or itraconazole oral in adults 200 milligrams daily, once daily, or 12 hourly for 7 days. In children 12 years to 18 years, you give 200 milligrams daily for 7 days. And 1 month to 12 years, you give 3 to 5 milligrams per kilogram, with a maximum of 100 milligrams once daily for 15 days or 30 days for tinea pedis and tinea menum. So that's why you give the maximum of 100 milligrams. Or you can give terbinafine oral in adults 250 milligrams daily for 2 to 6 weeks. In children over 1 year and body weight more than 40 kilograms, you give 250 milligrams once daily for 4 weeks, and 6 weeks to 3 months in nail infections. Body weight 20 to 40 kilograms, you give 125 milligrams once daily for 4 weeks, and 10 to 20 kilograms, you give 62.5 milligrams once daily for 4 weeks. Dermatophyte infection of nails, that's onychomycosis. So onychomycosis, first line treatment, you give itraconazole oral in adults 200 milligrams 12 to 24 hourly for 7 days, repeated courses after 21 days interval, a maximum of 2 courses for fingernails and 3 courses for toenails. In children 12 to 18 years, give 200 milligrams 12 hourly for 7 days, repeated courses after 21 days interval, and fingernails 2 courses and toenails 3 courses. 1 year to 12 years, give 5 milligrams per kilogram with a maximum of 200 milligrams daily for 7 days, repeated courses after 21 days interval. The fingernails 2 courses and toenails 3 courses. You can also give terbinafine oral in adults 200 milligrams daily for 6 weeks to 3 months, and in children over 1 year, you give 250 milligrams once daily for 6 weeks to 3 months. That's with a body weight over 40 kilograms, but 20 to 40 kilograms, you give 1 to 5 milligrams once daily for 6 weeks to 3 months. 10 to 20 kilograms, give 62.5 milligrams once daily for 6 weeks to 3 months. A second line treatment, you give griseofulvin oral. So griseofulvin oral in adults 500 milligrams daily, a double in severe infection for 4 weeks, and in children 12 to 18 years, you give 500 milligrams once daily or in two divided doses, and maybe double in severe infections for 4 weeks. 1 month to 12 years, you give 10 milligrams per kilogram with a maximum of 500 milligrams once daily or in two divided doses for 4 weeks. Um, for Candida intertrigo, you give benzoic acid compound ointment. That's Whitfield's ointment or Whitefield's ointment, topical. So apply twice daily to patches up to 1 or 2 weeks after the last visible rash has cleared. Or you give clotrimazole 1% topical. Apply twice daily to patches up to 1 or 2 weeks after last visible rash has cleared. Or you give miconazole 2% topical. You apply twice daily to patches up to 1 or 2 weeks after last visible rash has cleared. Or you can also give cyclopirox or cyclopirox olamine 1% topical. You apply twice daily to patches up to 1 or 2 weeks after last visible rash has cleared. And for oral candidiasis and pityriasis versicolor, you treat appropriately. Referral criteria: so refer to a dermatologist if patient fails to respond to treatment.